Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Okay. Now, hyperphosphatemia in acute renal failure. Remember, in acute renal failure, actually, in conditions in those patients where there is in conditions like rhabdomyolysis or hemolysis or in tumor lysis syndrome, in conditions like rhabdomyolysis, hemolysis, and tumor lysis syndrome, in these conditions, actually, there is hyperphosphatemia is occurring. Why? Because here in tumor lysis syndrome or in hemolysis or in rhabdomyolysis, there is breakdown of the cells. Because of the breakdown of the cells, potassium and phosphates which are present in the cells are released outside, are released into the blood. Because they are released into the blood, so there is hyperphosphatemia is seen in these patients, along with hyperkalemia is also seen.
thank you and thank you for watching.